The clinical anatomy of the carpus. Welcome back to Just Enough to Scrub In. Today, we're moving past the mnemonics. If you're in the ER or the OR, you don't just need to name the 8 carpal bones. You need to know which ones are going to cause a surgical emergency. So here are the 8 bones in 2 rows. Proximal, scaphoid, lunate, triquetrum, pisiform. Distal, trapezium, trapezoid, capitate, hamate. Now, let's break down the big 3 and the canals they live in. The scaphoid, the retrograde trap. First up, the scaphoid. It's the most lateral bone in the proximal row and the most commonly fractured carpal bone, usually after a fall on an outstretched hand, foosh. Here's the surgical must-know. The blood supply, from the radial artery, enters the scaphoid distally and flows retrograde to the proximal pole. If you have a fracture across the waist of the bone, you've essentially cut the life support to the proximal half. The result? Avascular necrosis, AVN, and non-union. Clinical tip. If there is tenderness in the anatomical snuff box, you splint that wrist immediately. Even if the initial X-ray is negative, occult fractures are common. Don't let your patient lose a wrist because you waited for a clear film. The lunate and the carpal tunnel. Now look at the lunate, sitting right in the center of the proximal row. It is the most commonly dislocated bone. On a lateral X-ray, look for the spilled teacup or empty cup sign. When the lunate dislocates anteriorly, volarly, it's not just a bone out of place, it's a space-occupying lesion. Look at this cross-section. The carpal tunnel is a rigid box. The floor is the carpal bones, and the roof is the flexor retinaculum. Inside, you have 9 tendons, 4 FDS, 4 FDP, 1 FPL, and the median nerve. When that lunate pops out, it smashes the median nerve against the ligament. That's acute carpal tunnel syndrome, and it needs decompression fast. The hamate and Guyon's canal. Moving medially, we find the hamate and its famous hook. This forms the lateral border of Guyon's canal, the ulnar canal, with the pisiform forming the medial border. The ulnar nerve and ulnar artery pass through here. A high-yield board and shelf question involves a golfer or baseball player. If they strike the ground hard with their club or bat, the force goes straight into the palm, often fracturing the hook of the hamate. This leads to ulnar nerve compression, causing tingling in the 4th and 5th digits and weakness in the intrinsic hand muscles. Pro tip: unlike the carpal tunnel, Guyon's canal does not contain any tendons, just the neurovascular bundle. So, remember, scaphoid for necrosis, lunate for median nerve emergencies, and hamate for ulnar nerve trauma. Master these, and you'll know just enough to scrub in. That concludes our lesson. Now up to the next one.